All right, knock, knock. I am performing hand hygiene and I'm putting on my gloves, okay? Hi, I'm Corey. I'm going to be your nurse today. Can you please state your name and date of birth for me?
My name's Lucy, and my birthday is September 7th, 2013.
Excellent. Okay, so let me go ahead and provide us some privacy. Providing privacy. Okay, so today I'm going to be performing a full physical assessment. So I'm going to start from your head,
To my toe.
move all the way down to your toes. Yes, ma'am. Okay, so basically what I'm going to be doing is I'm just going to be checking out each of your body systems and just making sure everything's working okay. And at this point, I have already gotten your vital signs, so we're good to go there. Your general appearance, you are well groomed, you're well dressed, you're appropriate to age, okay? So now I'm going to ask you, can you sit up for me, please? Oh, thank you so much. Now I'm going to ask you a couple questions about your health history, okay? Now, are you experiencing any pain right now?
No.
No pain, good. Do you have any allergies?
No.
No allergies? Okay. Let me think. Do you have any health issues?
No.
You're healthy? Okay. Does your family have any health problems, like a history of like cancer, maybe?
Not a history, but a couple of people died from cancer.
They
in my
did?
family.
How many people died?
Two.
Okay, all right. I'm sorry to hear that. Okay, so can you tell me about your diet? What do you like to eat?
Candy and vegetables
Candy
and fruit.
Candy, vegetables, and fruit. Okay. At least
But-
you added the vegetables and fruit in there.
But my favorite is caramel apples.
Okay.
And my favorite vegetable is celery.
Oh, that's good. Okay. Now, do you do any exercising?
Playing outside with my friends, playing superheroes.
How often do you do that?
Every day if my friends are home.
Okay. All right. Cool.
I'm gonna play with my friend later.
Okay, that's excellent. Okay. Now, to start the assessment, I'm going to start at your head. Okay.
Go down to my toes.
Yep, so I'm going to start at your head. I'm going to kind of feel around, okay? You can sit down. Yep, okay. So the head is smooth and symmetrical. All right, no sign of, dryness at the scalp, any dander. I'm not feeling any bumps. There's no lesions, okay?
What's a lesion?
Like a scrape, like a boo-boo. All right, so now,
I've gotten a boo-boo on my head.
I know. Okay, so now I'm going to look in your ears, okay? So I'm going to be, and I'm going to use my pen light, and then I'm going to be examining the internal and external structures. I'm not seeing any drainage or redness. Looking good. Okay. All right, so now I am going to I'm going to take a look at your eyes.
If you want to know if I've ever had any pain in my ears, I have. And I got an ear
Oh
infection.
man, I'm sorry to hear that. Okay, well I'm glad it's better now. All right, so now we're going to look at your eyes. Okay, so your eyelids are right where they need to be. Your sclera is white. Your corneas are transparent, and your bulbar conjunctiva is clear and moist. Okay.
What's a bulbar conjunctiva?
We'll talk about it later, okay? All right, so now for the next test, I am going to shine the pen light right on your nose, but I want you to stare right at my forehead, okay? Are you ready? Stare at my forehead. Good, 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 good. Okay, perfect. All right, so for the next test, I'm gonna pretty much do the same thing, but I'm gonna put my hand right on the bridge of your nose, okay? Put my hand here, stare at my forehead. Okay. No, up at my forehead. Good job. One more time. Excellent. Okay, so now what I want you to do is I want you to stare at the wall back here, okay? And then I want you to move your eyes over to the pen light. You can sit up for me, okay? So yep, stare at the wall, and then I want you to move your eyes to the pen light. Okay, can you do that one more time for me? Stare at the wall, and then pen light. Excellent. Good job. Okay, so your pupils are equal, round and reactive to light and accommodating. Okay, so now I'm going to test your fields of gaze, okay? So I want you to start here, and without moving your head, just your eyes, I want you to follow my light, okay? Up. Good. 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 Great job. Okay, that was good. All right, now I'm going to check your nose, okay? So I'm going to put my finger here. I'm going to check for patency. I want you to blow. Good. Good. All right, now I'm going to shine my little light up in there, okay? All right, don't see any obstructions, and the septum is intact, okay? So now I want to, okay, don't worry about the dogs. It's fine. All right, look. Hey, Lucy. Okay, so now I'm going to look into your mouth, okay? All right, so I am looking at the buccal mucosa. I'm looking at your palate. I'm looking under your tongue. Good job. Your gingiva. Now I want you to, can you stick out your tongue? Really? Go, ah.
Ah.
Good job. Look at that tonsil hanging down. And then the posterior pharynx. Oh, good job. Okay, so everything in there looks great. It's smooth. It's intact. And moist. Okay. All right. So we've done your mouth. Now, I'm gonna check your neck. Okay. So I'm gonna listen to see if I can find any funny sounds. Okay.
What happened to the funny sound?
Well, it might be something we'll have to get checked out. Okay. All right. So now I'm going to use the bell of my stethoscope. I'm going to put it right on your neck. Okay. So it might be a little cold. Let me warm it up. Okay. So I'm going to listen right on the carotid artery. Okay. I didn't hear any funny sounds. That is good. Okay. Now I'm going to touch your carotid artery. Okay. So there was no bruits or swishing noises heard, okay? All right, now, okay, put this down for me. I'm gonna do your carotid artery. Excellent. Okay, now I'm gonna go ahead and do your other side too, okay? So I'm gonna listen to the other side with the bell. No bruits or swishing. That's excellent. Yeah, or yes. All right, that's great. So the carotid is +2. All right. So now let's see here. I am going to now I'm going to move to your your chest.
Heart.
Oh yeah, we'll go ahead and do the heart, okay? All right, let's settle down, okay? All right, so we're going to do the heart, and so what I'm going to do is I am going to be listening to your heart sounds, okay? So I am going to start with the diaphragm, okay? Okay. All right, I'm going to start with the diaphragm, okay? Can you sit up for me and let your legs dangle? Okay. All righty. So we're going to listen to the aortic, okay, pulmonic, tricuspid, mitral. Okay, and while we're here, we're going to listen to the apical pulse.
Is that lungs?
Apical pulse, and apical pulse is 80 beats per minute and no irregular rhythm. And for the other ones, the S1 and S2 heart sounds were heard. And when auscultating, it would always be directly to the skin. Okay. So now we got to go through that one more time. I'm going to listen with the bell of the stethoscope, okay? So sit up for me. All right, we got the aortic, pulmonic, okay, tricuspid, mitral, Excellent. And no extra heart sounds were heard, okay? So now we're going to do that one more time, but I'm going to have you sit laying down, okay? All right, so I'm going to do the diaphragm and then the bell. So, all right. Hey, let's settle down, please. We're almost done. So we got the aortic, pulmonic. Oh, can't really see us. Tricuspid, and mitral. Excellent. And then we're going to do the bell. Okay. Aortic, pulmonic, tricuspid, and mitral. Okay. Excellent. All right. Now you can sit up for me, okay? I'm going to have you sit right here on the bed. Sit right here. Okay. I heard you, Lucy. We're in the middle of taking a video. Okay. All right. So now I'm going to look at your. I'm going to do your lungs and your thorax. Okay. Do you know what your thorax is? It is this area right here.
My
okay.
tummy?
Yeah. Yep. We got the heart in there. We got the lungs in there. Okay. All right. So I'm going to look at the posterior. Okay. And the shoulders are symmetric, okay, and then there is Ivy and Snickers. Shoulders are symmetric. There are no signs of using accessory muscles, okay, and then the anterior to posterior ratio is 1 to 2, and you've got great posture, okay. All right, now sit back for me. Great job. Okay. Yes. Okay. So now I'm gonna listen to your lung sound. Okay.
Yeah.
All right. So maybe what I'll have you do is I'm gonna have you kind of face that way. Okay. That way the camera can see you. Okay. All right. So I'm gonna start up here, and I'm gonna have you take a deep breath in and out. Okay. 1, 2, 3, 4, 5, 6, 7, 8. Excellent. Okay. Now I'm going to look at your anterior thorax. Okay, can you sit back up for me? Great job. Okay. So I am not seeing any bulging or retractions. The ribs all slope downwards and they're symmetric. Okay. And the anterior to posterior ratio is a 1 to 2. Okay. So now I am going to I'm going to listen to your lung sounds from the front. Is that okay? Okay. All right. You ready? Now I'm going to have you take deep breaths in and out. Okay. 1. Good. 2, 3, 4, 5, 6, 7. Oh, 7, 8. Okay.
So it's inhale and exhale.
Yeah, you did great. Okay, so normal breath sounds. And I didn't hear any crackles or wheezing or anything like that. So you're sounding good. Okay, so now I am going to take a look at your abdomen. Okay, so I'm going to have you. That's your tummy. Okay, so I'm going to have you lay down. Let me adjust this. Okay. See if I can get that so we can kind of see what's going on. Okay. All right. Now lay back on your
Back.
Let's see.
Lay back on your back.
Hold on. Okay. Here. I'll just move this right here. How about that? See if I can make that work. Okay. Hold on. All right, so now I am going to be, looking at your tummy, and I'm going to be expecting that. The skin looks good. It's free of lesions. Looks, it is dry and intact. Okay. All right. So now I am going to. Can I listen to your tummy sounds? Okay. So I'm going to listen to your sounds. Okay, so we're going to be starting in the right lower quadrant, okay? And I'm going to be listening to each of these sounds for 1 minute per quadrant, okay? So, and then it's going to be 5 minutes in total, okay? So I'm going to listen. Okay, so I'm moving to the right upper quadrant, left upper quadrant, and left lower quadrant. Okay, I heard normal clicks and gurgles throughout all 4 of the quadrants, okay? So now I am going to lightly palpate your stomach, so I'm just going to touch it, okay? So lightly palpate. Good. Good. All right, so the abdominal, skin on the abdomen is soft and non-tender, okay? All right, so now to the abdomen. Okay, so let me move this back over.
Can I sit back?
Yes, ma'am, you sure can. Okay, so now I'm gonna be,
Mommy.
hold on, baby. Now I'm gonna be looking at, can I look at the skin on your arms? Okay, let's see, okay, we're good. All right, so I'm gonna be inspecting the skin. The skin appears,
No dry skin.
yeah, it looks good. So the skin appears to be, dry and intact, free of lesions. I'm not seeing any coloring. Can I look at your nails? All right, no, the nails are pink. No sign of clubbing, so that is excellent.
I painted my nails with the nail polish.
Good. All right, so now let me touch your arms and see if there's anything going on. I'm not seeing feeling any, edema.
What's edema?
Swelling. Okay, swelling. And then no lesions. So the skin is warm, dry, and intact. Okay, let me check your fingers. Do your capillary refill is less than 3 seconds. Okay, so now I am going to palpate your brachial and radial arteries on your arm. Sit up, hey, sit up. We're almost done. Okay, let's see if they can see us. Okay, so now, okay. So brachial is +2, radial +2, and then
+2.
brachial +2,
+2.
radial +2. Okay, excellent.
+2 equals 4.
So the skin on your arms is great. Okay, so we checked that, and now we will move over to your legs. Okay. So can you lay back down for me? Okay. So let me move this again. Okay. So we can see us real good, right? Uh-oh. Oh, it's not that funny. Okay, hold on. All right. Okay. Okay. So now I am going to be inspecting the legs. Okay. So I'm going to be inspecting the legs. Let me try. Okay. All right. Oh no. No, we keep sliding. All right. So we're inspecting the legs. Okay. So oh, and the hair on the arms was also evenly distributed. Put your legs down. Let's get this done. Okay, so skin on the legs, no discoloration. The hair is evenly distributed. The skin is intact, free of lesions. So now I am going to, palpate the legs. Okay, no edema. Excellent. Skin is warm, dry, and intact. Okay, perfect. So we've inspected, we've palpated. So now I am going to check your femoral artery. Okay, so I'm going to do that on both sides. So femoral artery. All right, so we got +2, +2. So now we're going to move down. Let's see if we can get the camera to move down. Okay, there's your feet. Excellent. Okay, so skin on the feet. It looks good. We've got the toenails, no sign of clubbing. Let's do that capillary refill. Less than 3 seconds. Excellent. Okay, so now we're going to do the posterior tibialis. Okay. And then we're going to do the dorsalis pedis. Excellent. Both of those were +2. Come right over here. Posterior tibialis.
+2.
+2.
+2.
And then the dorsalis pedis. +2. Okay, excellent. So then, now we are going to perform some range of motion exercises. Will you stand up for me? This part will be fun, okay?
Do I do jumping?
Okay, all right, let's see here. All right, let's see.
I jump.
Okay, so you're gonna copy me, okay? All right, you stand right here. Make sure we're both in the picture. Okay. All right. So first, we're gonna do our shoulders, okay? So we're gonna put them straight out. Okay. Yep. So this is gonna be flexion, extension. Okay. Now we're gonna do abduction, like you're gonna steal somebody, and adduction. Okay. So that was for the shoulders. So now we're gonna do the elbows. So we're going to do flex on, right, and extension. All right, big muscles you got. All right, so then we got the, we're going to do the wrist, okay? So look, copy me. Okay, so we do the wrist. So we're going to do flexion, extension. Excellent. All right, now we're going to work out them hips. All right, okay, you ready? Okay, so first we're going to do flexion, okay? And then we're going to go back, extension. Flexion, extension, excellent. Then we're going to do abduction. Look, watch me. Abduction, and then adduction. Okay, bring it inwards, excellent. And then we're going to do abduction and adduction. Wow, you're great. All right, so okay. Did we kick our feet out? Did we do extension? Yeah, we did. Okay, so now we're going to do our knees. Okay. So we've got flexion, lift your foot up, and extension, flexion, extension. Great job. And then we're going to do the ankles, okay? So watch me. I'm going to pull my foot up super high. Okay, so we're going to do, we're doing the ankles. And no, you don't do that. You're going to hurt yourself. All right, look. So we're going to do dorsiflexion, plantar flexion. Then come over here. Dorsiflexion, plantar flexion. Okay, so now we're going to test your muscle strength, okay? So I'm going to have you lay down one more time. Okay. So come over to the edge of the bed. Okay, here. Let's see. Okay, hold on. I can't really see you. Okay, hey, here. Sit up for me. Okay, let me get that. Okay. So now what we're going to do, we're going to test your muscle strength, okay?
I'm strong.
I know. Okay, so what you're going to do, I'm going to have you grab onto my hands. I'm going to have you squeeze, 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 squeeze. All right, good. Now I'm going to have you, you're going to push down against me. Push, push, push. Okay. Now, let's see, you push down. And then I think it's like this. Okay. And then you
Push up.
did you already push up?
No.
Okay. Okay. No, I know what it is. Okay, let's start over. All right. So we're squeeze, 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 squeeze. All right. Can you pull away from me? Pull. Nope. Pull. That was pushing. Pull. Okay. Good job. And then I'm gonna have you push.
I can put.
Okay. And then put your hands under mine and push. Push up. Okay, good job. You're very strong. Okay, so now we're gonna do that with the legs too. So I'm gonna have you you just lay on back, and then I'm gonna have your. All right, so I'm gonna have you lift your leg, and then I'm gonna have you push down against me. Good. Now you're gonna push up against me. Okay, good. Now over here, push down. Oh gosh, strong. a push up. Okay. Good job. All right, so now we're going to do the feet, okay? Let me see if I got your feet. Okay, so I'm going to have you push against me and then push up against me. Good. Do it right over here. Push against me. Oh, good. And then pull against me. Okay, good job. Okay, so, yeah, and,
Now do it with my arms.
okay, so that concludes our assessment. Do you have any questions for me?
No.
Okay, well, it looks like you're pretty healthy then, huh?
Yeah.
You're healthy and strong.
No, but I can.
Okay, so I'm going to perform hand hygiene and remove my gloves.
I'm strong.